How to treat and cure malignant hypertension. Hypertension, or high blood pressure, is a common condition. High blood pressure is diagnosed if one or both of the following occur. Your systolic blood pressure is consistently over 140. Your diastolic blood pressure is consistently over 90. High blood pressure is generally manageable if you follow your doctor's advice. Although it's not common, some people with high blood pressure may have a rapid rise in blood pressure above 180/120ths of a millimeter Hg. This is known as malignant hypertension. This condition is sometimes referred to as arteriolar atherosclerosis. Malignant hypertension requires immediate medical attention. If you don't get emergency treatment, you may develop serious health problems, such as a heart attack, stroke, or kidney failure. Symptoms of malignant hypertension. High blood pressure is commonly referred to as the silent killer because it doesn't always have obvious signs or symptoms. Unlike moderate high blood pressure, malignant hypertension has very noticeable symptoms that include changes in vision including blurred vision, chest pain, a cough, anxiety, nausea or vomiting, numbness or weakness in the arms, legs, or face, shortness of breath, a headache, reduced urine output. Malignant hypertension can also result in a condition known as hypertensive encephalopathy. The symptoms of this disorder include severe headache, blurry vision, confusion, lethargy, seizure. Causes of malignant hypertension. Malignant hypertension mostly occurs in people with a history of high blood pressure. It's also more common in African Americans, males, and people who smoke. It's especially common in people whose blood pressure is above 140/90ths of a millimeter Hg. About 1% of people with high blood pressure develop malignant hypertension. Some health issues increase your chances of having malignant hypertension. These include kidney disorders or kidney failure, the use of drugs like cocaine, amphetamines, birth control pills, or monoamine oxidase inhibitors, MAOIs, which are a class of antidepressant medication. Pregnancy and preeclampsia, which occurs when a woman develops high blood pressure and protein in the urine in the late second to third trimester of pregnancy. Autoimmune diseases, which are a result of the body making antibodies against its own tissues. Spinal cord injuries causing parts of the nervous system to become overactive. Renal stenosis, which is a narrowing of the arteries of the kidneys. A narrowing of the aorta, which is the main blood vessel leaving the heart. Aortic dissection, which is bleeding along the wall of the aorta. Not taking your medication for high blood pressure. In some cases, these symptoms may not be due to malignant hypertension. They may be related to other health conditions that are less serious. However, malignant hypertension is so serious that you should seek emergency medical help if you have any of these symptoms. Your doctor will be able to provide you with more information about your condition. Malignant hypertension diagnosis. Determining organ damage. Other tests may be used to see if your condition has resulted in organ damage. For instance, blood tests measuring BUN and creatinine levels may be ordered. BUN stands for blood urea nitrogen, which measures the amount of waste product from the breakdown of protein in the body. Creatinine is a chemical produced by the breakdown of muscles. Your kidneys clear it from your blood. When the kidneys aren't functioning normally, these tests will be abnormal. Your doctor may also order the following: an echocardiogram or ultrasound to look for heart damage, a urine test to measure proteins caused by kidney damage, an electrocardiogram, EKG, to measure the electrical functioning of the heart, a renal ultrasound to look for additional kidney problems, an eye exam to determine if damage to the eye has occurred, determining organ damage. Other tests may be used to see if your condition has resulted in organ damage. For instance, blood tests measuring BUN and creatinine levels may be ordered. BUN stands for blood urea nitrogen, which measures the amount of waste product from the breakdown of protein in the body. Creatinine is a chemical produced by the breakdown of muscles. Your kidneys clear it from your blood.